And here in the studios of Joy News, I am Komala Adom. Now, the Ghana Health Service has encouraged the public to be conscious of their health following an outbreak of Lassa fever in Nigeria. The caution follows an alert from neighboring Nigeria, where an outbreak has been declared in 18 states. In an interview with Joy News, head of disease surveillance unit of the Ghana Health Service, Dr. Franklin Esidu-Bekwini, said though the country has recorded some cases in the past, Ghana is currently not battling any new case. He, however, urges the public to be conscious.
Last one challenge that we have had is that not in Ghana, other countries, that they have got some health workers who have been affected. So it means that you need to be sure and cautious about how to prevent infection. So in Ghana now, they are doing this mass training of health workers in infection prevention control. So the idea is to sensitize them that they need to be cautious in whatever they are doing. Then the communication. I think that we are in an era of, let me say, a very aggressive press. So we need to make sure we send the right kind of message to the populace that there's no Lassa, but we are alerting Ghanaians that there's a threat around us. We need to be careful. So that if you have a fever, you don't just assume that it's malaria, you go and take anti-malaria or some antibiotic and think that you're fine. It could be a Lassa. In that case, you need to report to a health facility and they'll be taken care of. So that's the import of our alert. And infection prevention is crucial because you may have also people coming to the health facility, and if you are not careful, by you trying to treat them, you may get infected. So the health workers are being trained on infection prevention and control on all other infectious disease conditions. So it's not targeted to Lassa. So this training has been ongoing for the past months, not because of Lassa. It's trying to make sure that health workers are well prepared to prevent infections. What we are doing now is to make sure that our surveillance system is very sensitive. What it does is that if the case should come, if you detect it early, the magnitude is very minimal, then it can be contained. So we call it what containment at source. So it doesn't become a big outbreak. So that is the essence of what we are trying to do with our response system. Yeah, no, Lassa does not have a vaccine, but the good thing is that there's treatment. There's an antiviral agent which can be used to treat case of Lassa. So the best effect is when you report early and it's detected, then it can be treated with the medicine. So there's medicine for Lassa fever.
Let's also stay with health-related stories because the Catholic health facilities in the Volta region are struggling to finance their operations and render quality health service to patients owing to delays in NHIS claim payments. The problem is compounded by the withdrawal of utility subsidies by government. The acting director of the whole diocesan health service, Emmanuel Hansen Tode, made a disclosure at the commissioning ceremony of some projects at Amfuega in the North Nine district of the Volta region.
The Catholic Church has over the years contributed effectively to taking healthcare delivery closer to citizens across the country. It has about 20 health facilities in the Volta region alone, with 7 as major health facilities in districts and municipalities where there are no public hospitals. Operations of these facilities are mostly fueled by provisions from foreign donor organizations and the National Health Insurance Scheme. But the acting director of the whole diocesan health service, Emmanuel Hansen Tode, laments the withdrawal of foreign donors and the delay in payment of the National Health Insurance Scheme claims, among others, has plunged the facility in a difficult position to finance its operations.
The delay in National Health Insurance Authority reimbursement and the economic tariff which is being faced by the government, refusal of NHIS to pay for specialist services offered in our hospitals continue to adversely affect our operational activities. We suggest to the authority as a matter of urgency to take themselves to review the current tariff for the services we offer. The whole diocesan health service is experiencing turbulence and uncertainties in the funding landscape for its operational activities and capital expenditure in recent times.
Mr. Tode says his outfit managed to undertake some projects aimed at improving service delivery to patients amidst the lingering challenges. A maintenance center and sanitary facilities have been commissioned at the Amfuega Catholic Hospital, while an emergency and accident unit is under construction to replace the existing one, which has limited space and very few logistics for healthcare delivery. Meanwhile, the chief executive of the National Health Insurance Authority, Dr. Samuel Ano, speaking at the Workers' Forum in the Volta regional capital, who indicated a little over 50% of the 1.2 billion Ghana cedis claims arrears were cleared at the end of 2017.
We assessed the situation and we found that there are 4 critical foundations that the scheme is lacking as we say today. And until we sort out these 4 foundational pillars, we'll get back to this point sooner or later. The first critical foundation pillar that as a nation we have to put down is the financing model. This model of using 2.5% VAT and 2.5% Senate contribution, putting that money, isolating it in a box to look after our health. As we said today, that money still constitutes about 95% of all funds used by National Health Insurance Authority. As the members were few, that money was enough. As the members increased beyond a certain point, we started falling behind. That formula was no longer working.
Fred Kwame Asari, Joy News.
Well, in addition to delays in claims, there are also complaints about inability to do new registrations at some centers here in Accra. Let's try and get some answers from the National Health Insurance Authority, and I'm joined in studio by Head of Marketing and Communications, Mr. Oswald Esiamen. So tell us more. Thank you very much, sir, for your time. First of all, has this particular case of a Catholic health institutions come to your attention, and what is being done about it?
Yes, the situation with Catholic Hospital is quite consistent with payments across the country. Okay. As it is in 2016, 9 months out of the 12 months have been settled to all service providers. And for 2017, we are on track. By and large, we've done payments covering up to July. And in the case of the Catholic Hospital, as I speak to you, I know payment from January to September has been done. To July, okay. And August and September is pending to be paid in a few weeks' time.
Tell us, what is the specific challenge with payment of some of these claims?
Well, generally, as you saw in the clip, the CEO did reiterate that the funding model, which has brought the NHI 15 years on, needs to be looked at and has to be re-engineered. If we have to build a resilient scheme going forward for the next 10 to 15 years, we must take a critical look at the funding that has brought the scheme this far. But with regards to payments, we have just embarked on a nationwide tour across the country, and we visited a lot of facilities. Suffice to say that we are behind in payments, but for the past 1 year, payments have been quite consistent. If you speak to providers across the country, they are really happy with payments that have been coming in because it enables them to be able to stock up. But what we're saying is that in as much as we're still behind a few months, which is technically allowed within the space of the insurance industry, we urge providers to concentrate on restocking the essentials for their facilities. When I say essentials, I mean the consumables, the medicines, which are critical to run the operations, rather than embarking on capital expenditure. You might find that some people, as soon as the money comes in, they're looking for big projects to fund and so many other things. I'm not saying that's not necessary, but given the state that we are in now, we're urging that, providers by and large should channel the funds that are coming quite swiftly now to provide for the care of our people. We have been able to do these payments not because we have extra funding coming in, but again, the scheme itself is also making sacrifices to the disadvantage of other providers of service to the scheme. And we're making sure that we're channeling almost about 90% of every funds coming in to pay providers. And this is how come we're able to sustain that. We've been quite consistent and we want to keep us doing that until the backlog is cleared.
We've also heard reports that there's some challenges being faced by some providers or some registrants at some centers, especially in Tema. Why do we have this specific challenge?
That's quite right. We have registration issues. We run a biometric system currently as we speak. In the next couple of months, we're in collaboration with National Identification Authority to take over the registration of members. To the extent that once somebody's registered onto the Ghana card, that's what they call it, you will automatically, or we will then be able to onboard you onto the scheme. So this is a transition phase that we're going through, that we have to synchronize our resources with National Identification Authority to make sure that by the time that we're switching over from NHI's card to Ghana, to the Ghana card, we will not have in excess of inventory of ribbons and consumables. So there's a few challenges here and there, but I have to speak with you now. Registration is currently going on across the country.
Well, there are rumors that you're planning to phase out the NIA cards. That's the reason why some of these challenges are being faced. Is that true?
Yes, because there's a directive from His Excellency the President to say that institutions should do away with the individual biometric systems that they are running, so that we have one integrated biometric system, which is the Ghana card, which will be launched in due course.
Okay.
And once that comes on stream, the Ghana card will now be used for a lot of services across the country. So NHI is one of the beneficiaries. I'm sure other state agencies who are currently running their own biometric systems would have to switch over to the Ghana card. So they'll have one singular card, which will create efficiencies across all the state institutions.
Finally, before I let you go, what's the plan for stranded, people who want to register onto this scheme?
As I say to you now, we have consumables in all our registration points. Registration is ongoing. As we speak now, we're also piloting a system which will come on stream very soon, and that system should enable our members to be able to renew their cards via the use of mobile phones. And that will create a lot of or reduce a lot of frustrations that people are going through right now. So you can do it in a comfort, because as you look at it now, we tend to realize that a lot of the congregation of people at the registration centers is to do with renewals. So if we're able to devise an effective mechanism where people can register online or the use of a mobile phone, that is going to take away a lot of the traffic that is going currently to our registration centers, and that will ease the pressure for our members.
Many thanks to you, Mr. Oswald Isha Mensah. He is the Head of Marketing and Communications at the National Health Insurance Authority there, speaking to us. You're still watching Joy News today, and stories gone by so far. We brought you that chilling story about a 17-year-old girl who has been thrown out of her home by her father because she is HIV/AIDS positive. Also, we brought you the story about Ghana Health Service dismissing the outbreak of Lassa fever in Ghana, but is urging the scale-up of public awareness to prevent an incident in Ghana. And still to come, former Chief of Staff Nana Atudatsi warns of premature resignation of a special prosecutor because, according to him, the Office of Special Prosecutor is not truly independent. Also, Ministry of Transport dismisses claims it is aware of new transport fare increases, directing vehicle operators to revert to old fares until further notice. You're still watching Joy News today. Now, even before he is sworn in, Martin Amidu's eventual resignation is already guaranteed, or at least that is what Nana Atudatsi believes. The former Chief of Staff under the Rawlings administration has predicted that the President's nominee for the Office of a Special Prosecutor will walk away from a job as soon as his independence is compromised. Speaking on News Desk a while ago, the lawyer and international consultant expressed his agreement with Amidu's longtime colleague, John Debugri, that it is only a matter of time until the man who has become known as a citizen vigilante hands in his resignation to the President and walks away from his role as Ghana's first ever special prosecutor.
If I do know Martin, if anybody attempts to go that far to try and influence him, I'm sure he will back out. He definitely will back out. That's why I'm saying that, you see, we should, as a nation, we should be happy that we are bringing forth an institution. Not an individual. You know, I wish we would move the debate from Martin Amidu as a person to the office of special prosecutor. Assuming that he comes and the very first case, they say, Martin, after this you should look at it. So then I walk out. Then what happens? Do we drop the institution? You know? Yeah. But it's a very, 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 very grave institution. There have been, in fact, it's not really new, in the sense that, because in our history, we've had attempts at setting up, quote, special prosecutors, you know, AFIC, PNDC, you know, all that. I think Mr. Martin Amidu must have, if my memory serves me right, served as part some time ago, you know. So the question is, why were those institutions, or why did those institutions not survive up to today? Why did they fail? In some cases, internal corruption within the system. You understand? If we set up a special prosecutor's office and it turns out to be internally corrupt, you see, it's used to extort money, you have a problem. I heard him right with his experience. He did say that he was going to prosecute outsiders, but he will also prosecute people inside his own establishment who go out. We should be fearful of this and put structures in place which will ensure that there are protocols for dealing with cases. You know, and that's why you have prosecutors also walking down the street, you know, asking people, give me this or give me that, otherwise I'll file a complaint against you.
Now, in a matter of 5 years, the menace of head poaching common in the country's major city centers will be a thing of the past. This is the assurance from the Minister for Gender, Children and Social Protection, Madam Utiko Afisa-Jaba. In an interview with host of AM show on this portal a couple of hours ago, the sector minister indicated a 5-year program designed by government to eradicate poverty will address the problem of head poachers as well. She said rehabilitating these less privileged girls is a collective responsibility. Just that's appeal to all and sundry to put their hands on deck to fight poverty in all forms.
The Ministry of Gender has a program, a 5-year program, to eradicate Kayaye, with especially the advent of free SHS, linking them up with skills training and so on and so forth. The one district, one factory, small cottage industries, entrepreneurship. You know, you start small. You can start making gari. Before you know it, you have a gari factory or groundnut paste or making beads or whatever it is that you want to do.
Just to create that empowerment.
Exactly. Because you see, Ghana cannot accelerate at the pace at which we want to accelerate unless we change the circumstances of the very vulnerable, the very poor. It's a point where we have reached that to build the new Ghana, each of us must be economically empowered. To be economically empowered, you need education, and then the planting for food and jobs, and then you move out of extreme poverty. We have the LEAP that supports extreme
all these you have budgetary funding for it, or sometimes you have to bring in your donor partners, etc.
Largely, we work with the donor partners. We also work with the local government, because all these different people live in the communities, and so we have a very close program with the DCEs, largely local government, and then the social welfare in terms of case management. There is never enough money, and that is why it's important that everybody's child of school-going age must be in school. And we must understand that it is not easy to get out of poverty, but we all came from poverty. So we need to be caring and tolerant of people who are not as able as others. And don't just say that, oh, they want and they came to Accra. But we all have migrated. Some are doing well, some are not doing so well. So those who are not doing so well, the Ministry of Gender is imploring the media and philanthropists and everybody else to have a collective responsibility. Today is Valentine's Day, so we must show some love to the vulnerable, and we must help them to get into school. And we must stop giving alms to beggars on the streets, because it's demand and supply. The more you give, the more you encourage them to remain on the streets. And when children get used to receiving monies, then they don't want to go to school.
So the key word is empowerment.
So the key word is empowerment.
Teach them how to fish.
And then love.
Let's now do a story I'm sure many of you will be interested in. Now, a number of commuters jumped onto their regular public transport Monday morning only to be greeted with a new transport fare. Not only were they surprised, but the difference has caused many to ask questions and the basis for which these increases have been made. In response to the new increments, however, the Ministry of Transport has directed all transport operators to revert to the old fares till further notice. PRO of the Transport Ministry, Gloria Holmes Graves, in a press statement dismissed claims by some driver unions suggesting the ministry was in the know about the new increases. She has been speaking to Joy News in an interview.
I would like to state that the information making the rounds that the Ministry of Transport has met with transporters to review upward road transport fare is false, and that we should disregard that piece of information. The ministry has a standing arrangement with the road transport service operators to meet biannually to discuss fuel prices. We are in discussion with them. We are meeting with them to ensure that if there are any such increases in those three elements that affect road transport fare increments, like investment, fuel price increases, and spare parts, then we would have to sit down and then look at them, and then we may have to communicate whatever the outcome may be to the public. We are in touch with the transport operators, and we are still gathering data concerning those elements which we consider in determining the fares. As soon as we are through with all the necessary information from the transporters and we sit to agree on the way forward, we would come out and we will let the public know. The public is being urged to keep paying whatever fares they are used to until that directive from the ministry comes.
You're still watching Joy News today on your most reliable news source. Joy News will take a short break and return with business. Joy News today. Before we do business, let's take one more story. And Lassa District Chief Executive Martin Dometieri Bombaire has directed that all new buildings in the district must have toilet facilities. Owners of existing and old structures should, by the end of 2018, provide toilet facilities in such properties or face the law. The Assembly, in a bid to deter people from indulging in open defecation, is collaborating with the traditional authority to enact bylaws. Martin Dometieri gave the directive at the celebration of the open defecation-free status of 51 communities in the Lassa district. Joy News' Upper West correspondent Rafik Salam reports, but I have to say that some of the visuals coming up are a bit disturbing.
Open defecation is one of the key sanitation challenges that militates against the attainment of total sanitation in Ghana. The practice, which allows people to defecate in the open environment, was prevalent in 94 communities, representing 15% in the Lassa district. However, with the intervention of the Netherlands Development Organization, SMV, in 2014, the sanitation situation in the Lassa district improved to 51% in 2017. Under the theme, Open Defecation is Anti-Development, Let's Stop It Now, the Lassa district in the Upper West region celebrated the achievement of open defecation-free status, with 51 communities out of 110 reaching ODF status. The feat, chalked by the district, has catapulted it to place second fiddle to the Nandom district in the CDD District League table log in the Upper West region. Country Director of SMV, Ham Duka, commended the Lassa district for achieving the feat and urged the District Assembly to commit more resources to the Environmental Health and Sanitation Division of the Lassa district to enable them perform their tasks effectively.
As Country Director, I really would like to express my appreciation to the Chiefs, management of Lassa District Assembly, the Regional Interagency Coordinating Committee on Sanitations, and other institutions that constituted together the District Interagency Coordination Committee on Sanitation. This shows that an integrated approach in solving sanitation access in rural areas is working. According to an end-line household survey conducted by the project in the last quarter of 2017, the proportion of households who still practice open defecation has been reduced by 6% from the baseline figure of 78%. This is a very impressive figure. Although we still have challenges, as just mentioned, still 50% of the households don't have a latrine on their own, but still share the latrine with their neighbors.
In his address, Lassa District Chief Executive Martin Dometieri Bombaire highlighted the impact of the intervention of SMV that has resulted in the 51 communities that have attained the open defecation-free status.
Our wish to celebrate 100% district-wide ODF today, but it is not the case because some communities and sections remain a threat to our achieving 100% ODF. I wish to use this opportunity to appeal to the leadership of these communities, particularly the chiefs, queen mothers, assembly members, and the entire community members, to emulate the achievement of the ODF communities and ensure that they all support the fight against ODF.
Martin Dometieri Bombaire directed that all new buildings in the district should have sanitary facilities in their drawings and also provide toilet facilities in the existing structures.
For the existing and old buildings, we have directed owners of such structures to consciously provide toilet facilities in them before the end of 2018. At our public places, ladies and gentlemen, we have in plan not only to build public toilets, but shall ensure that these toilets, when built, are well and properly maintained. To further deter people from defecating outside their homes, the District Assembly, in collaboration with chiefs, queen mothers, assembly members, and the youth, will enact bylaws that will ensure that those who violate these bylaws are punished accordingly.
23 natural leaders from the district were awarded. Doniel Edward is one of them.
The hazards throughout the night, you could be going out to toilet and then probably step on a serpent. That one is also free. And one embarrassing thing is also, you have somebody you so much respect, then you go and squat behind a shrub. Probably fellow is far behind you, looking at you. When you get to know that there's somebody behind you, you can't even continue to shit. It's a very big problem. So as for the benefits, they are so numerous.
Reporting for Joy News, Rafik Salam, Laura.
You're still watching Joy News today. I am Komla Adom. Emmanuel Abwajirafi joins me in a moment with business.